Stagnation in your enteric nervous system is very much intentional by design by the food and the healthcare industry. You can tell by the foods that are made available in the supermarkets when you go to shop. The so-called organic foods are still littered with a tiny amount of pesticides, not as much as the ones that are outside of the regulation, right? Such that now when you go to see your doctor, you're not informed about what the overall impact is of the foods that you consume, right? This is the reason why we advocate for eating foods that are highly and very rich in fiber. Hi, my name is Richard. I'm a health coach. I help people over the age of 40 transform their health through lifestyle modifications such as sugar reduction. Now, the average person that goes in to see a doctor, you have to take into consideration that when the doctor sees you, he sees you and considers you by the symptoms that you present. I've had a little bit of experience, so now when you take a board exam, most of the questions that are rendered on how doctors are trained, they will tell you the exams are structured in such a way to say, patient presents such and such symptoms, how would you proceed? By default, when the doctor sees you, his first inclination is not to say, well, based on the symptoms that you have to consume more fiber in your diet, right? Hence, you have the controversy between foods, fruits and vegetables. And this is the reason why most health professionals would advocate that you spend time exercising, consuming fruits and vegetables. Now, fruits, on the other hand, are very controversial because they have fructose in them. So they tend to have insulin spikes. But what they're not telling you is that those insulin spikes are not as large. These fruits help to feed your microbiome, right? Taking this into consideration too, now you understand also that when you are eating foods that are low in fiber, there is a faster assimilation, faster insulin spike. And then foods also that are littered with toxins and herbicides now disrupt your brain-gut connection, right? Your stomach houses most of your defenses. Your stomach is a major center for where neurotransmitters are being produced to regulate your mood, right? So now if that system is disrupted in such a way that you can no longer assimilate the food in there because one, now you have irregular insulin spikes or you have a large amount of toxins in the body, now you send your energy centers into a frenzy. That over time will lead to blockage or prevention of creating more stagnation in your body, leading to things like type 2 diabetes and autoimmune diseases, high cholesterol, high LDL, right? Exercise, sleep, and proper nutrition is of the utmost importance to feed the bacteria. Like the saying used to be, you are what you eat. In actuality, it's all what you are able to digest, correct? Because now when you digest the food is what actually gets into the system and replenishes the system. And seeing how we are 9 parts of bacterial DNA and 1 part of human DNA, most of the foods that you're going to eat anyway is going to go into the feeding of your bacteria. And this is where your probiotics and your prebiotics come in. This is where the fiber comes in. Now, when you eat foods that are high in fiber, you're able to satisfy the needs of your bacterial system, which in turn gives you back as a symbiotic relationship, gives you now back the ability to have higher energy, higher output. I know this is a little bit of a longer video, but if you like this information, feel free and share it. You don't know who you're helping in the process. In the meantime, leave a comment in the comment section. I love y'all from the bottom of my heart. I'll talk to y'all really, really soon.